Hello, this is an OET speaking sample video. With me is Akhil and he'll take the role of the patient. And I'm Sangeeta and I'll be dealing the role of the nurse. So Akhil is a child patient. He's Nicholas and 10 years old. So Nicholas is here to see me regarding his bedwetting problems. So it's a highly sensitive topic and I cannot expect the child to talk much about it. So this sample is also about how you can deal a patient who does not respond much. And because this is a very embarrassing topic for the child, he might not give the right responses. So it becomes the responsibility of the nurse to ask the right questions. In most of the videos that we've done regarding samples, there have been queries whether to begin the conversation with a greeting, is introduction required, and so many such queries. So this sample will probably have an introduction, and it is not required that for every sample or every speaking scenario you need to introduce yourself. That highly depends on the setting. If it's a hospital ward, you already know the patient, so probably you don't need to introduce yourself. So again, if it's the patient visiting you for the first time, you might require an introduction or you might not. In this case, his GP has referred him to me. So there's a chance which is high that I already know the patient's details, though I don't know him in person. So let us see how you can deal such a situation. So we've already prepared on the card, so we'll go right ahead with the conversation. So shall we start, Akhil?
Yeah.
Okay. Hello Nicholas, thanks for coming in to see me.
Hello.
I'm Sangeeta and I'm the clinic nurse at this bedwetting clinic. Please sit down.
Thank you, sister.
So Nicholas, your doctor has asked me to discuss your problems with you.
Yeah, sister, he referred me here.
Yes, I understand that unknowingly you happen to wet the bed at night.
Yeah, I'm really sad about my condition. But sister, I don't want to share my things to somebody else.
Okay, I can understand what you're going through. But remember Nicholas, in most cases it is quite normal for kids this age and especially boys to wet their bed. So don't think there's something wrong with you.
Yeah, but I'm really sad about my condition, sister. And I'm really impressed about this condition. And I'm scared about my confidentiality.
Okay, you don't have to be upset, Nicholas. Like I said, there are a lot of children who come to me with this issue. So what I can do right now is try to help you out. I'm sure you're looking for some kind of solution to solve this, right?
Synergy, is there any permanent solution for this?
Definitely there is. So like I said, it's quite normal for children of this age to wet their bed at night. So it will take some time. You're around 9 or 10
Yeah,
right
I'm
now?
10 years old.
You're 10 years old, right? So can I ask you a few questions, Nicholas, because that will help me, understand your case better.
Sister, let me know why you want to ask me questions, because you know already my problems.
Yes, I know. Like I said, your doctor has referred. I have your file with me.
Yeah.
But to help you now, he's asked me to discuss this with you. Okay. So if I need to, like you asked me if there is a permanent solution. Like I said.
I'm not in a good mood to answer seniors.
Oh, okay. So let's have a normal chat. Don't worry. It's nothing, a lot of details that I'll be looking for.
Okay.
Maybe I just want to know, does this happen every night, Nicholas?
Yeah, it happens every day.
Okay. Alright. So frequency, I'll mark it as daily. Alright. So let's try and find out why this happens, because there should be some reason, right?
I don't know much about this.
No problem. I'm here to help you out. Now, Nicholas, mostly this runs in the family. That means probably somebody in your family, like your mother or father, would have had this problem as a child.
I'm not sure about sister. I don't know
Yes,
the
you will
things.
not know about it, but I'm just telling you to help you
Yeah, okay.
feel better. Okay, this is something that happens. So that could be one of the reasons why you have this problem. Okay, so this is one. Can I just know how much of water or drinks that you have before going to bed? Do you drink a glass of water or anything like that?
Since I don't have a count on that. Recently, I don't take much fluids because of this problem. I know when I take much fluids, it will happen.
Okay, so Nicholas, not taking fluids is also bad for your health. Like you said, what you're doing is slightly right. Through the day, you can ensure that you're taking in a lot of fluids, water. Okay, but when it comes
prevent this
at night, right? So during the day, make sure you're well hydrated by drinking the right amount of water.
Okay.
And at night, maybe you can reduce the quantity. Let's say after 8 o'clock, don't drink a lot of soft drinks or orange juice or anything related to caffeine like coffee, chocolate drinks.
Is there any medications? I want medicines actually.
Well, there is a medicine that will help you for now, but with time and with a little training probably you can outgrow this habit. So please be assured that this is not something that will continue forever. It could be, like I said, one reason could be it runs in your family. The other reason could be that your bladder is really small. Okay, so maybe it doesn't have a capacity to hold urine for a long time. Now that could be a reason. Okay, so one suggestion is if you can keep an alarm at night. Okay, let's say at what time do you go to bed, Nicholas?
8 or 9, sister.
Okay, so let's say you go to bed at 9. Maybe you fall asleep by around 9:30.
Maybe.
So set your alarm at maybe 12:30 or 1 o'clock. Okay, so you can get up at that time. And then if you feel like going to the toilet.
It will be difficult for me.
Oh, is it? Why don't you give it a try first? Maybe it will help you.
Yeah, we'll try.
Okay. So if you set an alarm like this, maybe when you wake up, if you feel you want to go to the toilet, you can use the toilet. Okay. So this is probably a condition where you're not getting the signal that your bladder is full and you're maybe a deep sleeper. You sleep really well.
Yeah.
Okay. That could be a case. So if we try this for some time, slowly you can train your bladder that way. Okay. So that is one thing that you can do.
Yeah.
And if you're a little keen on medication, some kind of medicine, I need to talk to the doctor also regarding it.
Yeah.
Okay. So probably you can use.
Yeah, this end of your speaking time. Thank you.
Thank you.